Welcome back. Today in our Sunday Spotlight, making sure those caring for a sick, injured, or dying pet get the support they need. The owners of Bolton Veterinary Hospital recently hired a licensed clinical social worker to help pet owners and the care team work through the trauma they experience. We're happy to have Michele Watson here, along with two of the partners of Bolton Veterinary Hospital, Dr. Shonna Kalos and Paul Badeau. Thank you.
Thank you.
Thank you.
Let me start with you, Shonna. You're farthest away. We'll work our way back in. Tell me, how did this all come about?
So initially, there's been, a big uptick in the service of our staff and our veterinary colleagues with the mental health situation in this medical profession. It's been a challenge to provide good care for our clients and our staff. So we recognized that need, and we reached out to Michele after having a student intern fulfill her social work hours with us, and saw that it was a great benefit to our staff, as well as the ability to refer many of our clients to talk to her about grief and guilt and difficult decision-making in general.
And now, Paul, I'll move to you next. You said this exists other places. It's not a new, novel idea, but it's an important idea.
It's a very important idea. Thanks for having us today, Eric. We are one of few hospitals in the state currently that have a social worker, and we're privileged to have Michele as full-time. Even as close as Massachusetts, there's just a small handful of practices that are able to offer this service to their clients. And we've really tested ourselves with how do we enhance our client experience, and how do we also provide a higher level of service for our employees. A lot of it comes down to that our beloved pet is not really a pet anymore. They're members of the family. So with that, our clients are tasked with very difficult decisions, some that you don't even deal with in human medicine, end-of-life, quality-of-life decisions. And with that comes emotions, comes tough decisions. And we're fortunate enough to have Michele, who can help our clients navigate that route.
Well, let's ask Michele about that. So tell me what your role is and how it's been going.
Well, it's an amazing opportunity as a social worker. So, in general, social workers can help with crisis intervention and provide resources and supportive counseling. And this unique position allows me to work with the staff and with the pet owners, which allows me to be able to touch more people and give them access to important mental health topics.
Well, listen, anyone who's had a loved one in a hospital, a human loved one in a hospital, knows those big hospitals, Hartford Hospital, St. Francis, Yale, they all have social workers on staff. So if you have a pet who's going through a tough procedure, or perhaps is needing end-of-life care, that's an important role. And do people who you approach, the pet owners, do they say, oh my gosh, I needed this and I didn't know it?
Absolutely. Definitely getting great response about the appreciation that it's a valuable resource to have. There's a term, disenfranchised grief, which basically means that society or some grief might not be acknowledged the same way. Some people may think of pets or it's just a dog or it's just a cat. And so, my position really allows me to accompany people on their grief, help them in their journey, and to take it seriously as a significant loss. I mean, animals enrich our lives. The connection that we can have with them is sometimes simpler than our human relationships. They give us love and joy and accept us as we are. So being able to provide this service is really meaningful.
Shonna, let me go back to you. It's also, and Paul talked about it, it's not just for clients, it's for the staff as well, because a client may come in and have to put their dog down or make a difficult decision. It's a very, very, very bad day for the staff, for the client. But the staff is there seeing that over and over and over again. So is that part of this?
Absolutely. It's really important that everybody has the support they need and someone to reach out to help hold their hand. There could be a day where you may have 3 or 4 different clients perform a euthanasia, and in the next moment you've got to walk in and see a new puppy and be happy. And that takes a toll on us, the ups and downs. In addition, I've had clients say, this was harder than saying goodbye to my mother, which is ridiculous, but true. And in the same breath, you know, they are now faced with saying goodbye to this animal they've had as like a child for 17 years or what have you. And so the staff really does take that on, and we sometimes will, you know, the assistant that I've got in the room, I'll reconvene with. There may be a pet that's been in the hospital for a week battling and loses its fight, or, you know, the difficult decision is made, and that's difficult for those who have been caring for that pet one-on-one with, you know, intense ICU care. So it's true, we like to have now this new possibility for everybody to decompress and share their grief and help deal with that.
We're running low on time. We have like 2 minutes left, but Paul, I want to ask you before I get back to Michele. Before Michele or a social worker existed, in preparing for this, it occurred to me you were probably the social worker in many cases. Did that something that fell on the veterinarian to also comfort the client?
It did, Eric. So really, we were trained in veterinary medicine, naturally. And I think most individuals, and including our nurses, are very compassionate people. But there was a disconnect there. And we are not trained mental health providers. And the human-animal bond is a very tight thing. So we, you know, once again tried to figure out a way that we could find an expert in her field, Michele, to collaborate with us to provide better service to our clients and ultimately our patients.
Well, you're here because it's been such a success so far. I know one of the things you have is a pet loss support group, Michele. So what's your message? I mean, whether it's to other veterinary practices, maybe they should bring in someone like you, or a pet owner who, you know, listen, I have a 6-year-old dog, hopefully he's going to live for a long time, but I'm going to be a mess when something happens to poor Dixie. So what's your message to dog owners or cat owners or pet owners, how your role plays into that?
Well, I'm here for support for anything along the journey. So if it's, you know, something chronic about going through diagnoses, chronic caregiving, I'm happy to have conversations, not just the group, to be able to help with those things. But the group is on Tuesday nights at 5 p.m. and that if they contact me or on the Facebook page, I can send them a link and help that way.
Well, I think it's a very important topic, and it's something that like you said, Paul, it's that bond is strong, and people have that connection of coming home and the dog is there waiting, or the cat is there when they wake up, and to have to make a difficult decision or to deal with a chronic illness, I can certainly see how it could be a very trying time for someone, and to have that support is innovative, and I think it's an interesting idea, and that's why I wanted you all to come in and talk about it. Michele, Paul, Shonna, thank you all for being with us, and hopefully this service proves to be a great success.
Thank you so much.
Thank you, Eric.
And that is CT 24 for this week. CBS Sunday Morning is, of course, coming up next. Have a great rest of your weekend. We'll meet you back here in Studio A next Sunday morning.